It is Men's Health Month, and one of the biggest topics right now that is still not widely talked about is men's mental health.
Yeah, new statistics show that more than 70% of those that identify as male experience symptoms of common mental health issues. Dr. Ashley Zucker is a psychiatrist at Kaiser Permanente, San Bernardino. She's joining us live this morning with more insight. Dr. Zucker, thank you for joining us.
Thank you so much for having me.
Doctor, first question is, there is still a stigma around men's mental health, and statistics show they're less likely to ask for help before it's too late. Where do you think this comes from and why?
I think we've had a long history of a societal norm where men aren't supposed to talk about their emotions. You know, there's the term man up we hear a lot, where men are just supposed to kind of carry on and not show emotions, as that might be a sign of weakness. But I think we really need to shift that narrative.
Yeah, because it impacts everyone. Let's talk about for men who have families, they have children. How does this impact their kids if the men don't know how to talk about the mental health issues they're dealing with?
So I think all the time about the fact that as parents, we're role models for our kids. And so how we talk about our emotions, how we respond to difficulties with our emotions, which we all have, is something that our kids pick up on, and then they mirror themselves as well. So if we're struggling and they're struggling, they may pick up on how we're not necessarily seeking the help that we need.
Okay, well, doctor, let's say, someone who is watching this morning has a partner or a man in their life who is struggling right now. What can they do to help?
I think the first step is just to talk about it as much as possible. You know, people aren't really always willing to open up, but even just starting the conversation can be the first step. Something like, it looks like maybe you've been having a difficult time lately, anything you want to talk about. Even things as simple as that can be helpful.
Yeah, because it's hard sometimes for them to even make that first step and talk about it. So let's say they do talk about it. They open up and say, I'm depressed, I'm anxious, things are hard right now. Then what's the next step?
So a great place to start is with your primary care physician. They can often be helpful themselves, or they can refer you on to a mental health specialist or a psychiatrist if that's most appropriate. But that's really the best place to start if people are truly struggling.
And doctor, finally, I want to ask you, if there is a man out there who's watching this segment and, is going through this struggle, what would you like to say? What would be your direct message to that person?
You know, there are so many things I'd want to say, but I think the most important is that we all have emotions, and we have good emotions and times where our emotions are not doing so well. And we all need to talk about those. And I think, again, just to remember that we are role models for all of those around us, including our children. And so we want them to also know that it's okay to talk about their emotions. And in fact, it's a strength to talk about your emotions.
So true, man or woman. Dr. Ashley Zucker, thank you so much for joining us this morning.
Thank you so much.